Right, so I'm just waiting for my co-facilitator Carol to join, and we're due to kick off now. A very big welcome to everyone who's on the session already. It's fantastic to have you join us, and it's fantastic to have people from at least 3, if not all 4, of the shortlisted entrants under this category. I'm just looking to see. Paul, have you had any message from Carol?
I'm trying to find out the background for you, Diane. So apologies. Okay. I may interrupt if I get an update, but other than that, I'm chasing in the background for you. Okay.
I think, Paul, what I'll do is let's get started because time is tight and people are joining to hear from the shortlisted entrants. So I don't want to lose any time and opportunity there. So I make it 10:35. So a very, very big welcome to everyone to the NHS Improvement Awards Showcase. And this showcase is focused on spreading change and improvement across systems. So welcome to everyone, and a particular big welcome to those who have been shortlisted in this category. Great, congratulations and well done. My name is Diane Ketley. I'm a member of the NHS Horizons team. I've worked in the NHS for a long time, starting out as a clinical pharmacist and moving into research and then into the area of improvement at local and then national level. So very pleased to have you here. I was next going to ask Carol to introduce herself, but Carol will join us, I'm sure, as soon as she can. What I'd like to do is ask you to introduce yourselves in the chat. Some of you have been doing so already. We will use the chat as a way of connecting and communicating. If you have any questions, please ask them in the chat. Please ask them in the chat. Oh, everyone's joining us now, right? Ask them in the chat, and the nominated entrants will be able to answer in the chat as well, because we are short of or quite tight for time. Lots of smiling faces and waving. Fantastic to see you all. Paul, could I ask you just to introduce yourself and give us any housekeeping tips that we need to be aware of, please?
Thanks very much, Diane. My name's Paul Woodley. I'm part of the Horizons team and privileged to be here and helping to support these events today. But the events today are for yourselves. So Dan will be masterfully leading us through this session. We'll hear from several of the award winners, I believe. I'm here to help with tech. So if anyone has any problems, please post it in the chat. I'll try and monitor that and support you. And if you've got any questions, please do post the questions in the chat so that we can bring them to the panel when we get to the appropriate points. Thank you.
Lovely. Thank you, Paul. We're in very safe hands with Paul. I feel very happy he's here looking after us. So thank you, Paul. Can I just check before we progress? I know that we're fortunate and have people from 3 of the shortlisted groups. Do we have anyone here from NHS South, Central and West CSU who were shortlisted for creating a national immunisation service? If so, could you shout as quickly as you can? Apologies for... Right, apologies from some of your colleagues. Okay. Yes, time has been very tight. Okay, so no one... oh, so Vanessa, are you able to speak about your shortlisted? Yeah, okay, you're in there. And the request for the speakers is to spend about 3 minutes, really tight, I'm afraid, talking about the work that they've done, particularly from the spread point of view, and maybe time for a question or two afterwards. So that's the format. We're going to spend most of the time listening from the shortlisted entrants, which is what we all want to hear about, isn't it? Just before we move on, I would just like to say how delighted I am personally. The spread is one of the 6 topics for the big conversation. I don't know if anyone else feels the same, but I was so excited when I saw that, because Spread and adoption and scale and sustainability have been a topic of interest to me for a long time. And I don't feel that they've had the energy, time, resource, focus that has been needed because they're an integral part of change and improvement innovation. So fantastic that Spread appears as one of the awards, and fantastic that we've got you here. The large number of applications, diverse, very broad, very high standard. So it's great. Congratulations for you to be shortlisted, and really great that you're here today. So without further ado, let's move on. I will ask in no particular order. I think we have now 3 set of presentations because Vanessa, you've sent your apologies. Your colleagues are not being able to join us, and you don't feel able to, which is absolutely fine. We don't want to pressurize anyone if you're not in a position to do so. So we're not ignoring NHS South, Central and West CSU, shortlisted for creating a national immunisation service. But Vanessa, if you're the kind of representative and you'd rather not talk, we'll leave it at that. It's still there as a shortlisted entrance, but we won't allocate time at your request. So that
apologies, sorry. I only came back from holiday this morning, and we saw the invitation for nobody had picked it up in my absence. So unfortunately the colleagues who could talk very eloquently about this are on a customer call this morning, so they can't join. Yeah,
absolutely. Totally understandable. Things have been quite hectic, as you may have heard if you joined some of the earlier sessions. This is a huge undertaking. First time anything like this has been done. There's been lots of learning gained along the way, and I think timescales have been a little bit tight in a lot of areas. So apologies for that. Obviously, the work is still shortlisted.
Brilliant.
So it's not going to impact on the decision. So I'm very glad that you're here, and you can report back to others, I hope. Okay, so we'll move on. Still, Carol must be having technical problems, so apologies, Carol. We'll just move on to the first one, which I think is Megan. So Megan, you're from the Royal College of Paediatrics and Child Health and US submission, shortlisted for establishing quality improvement training programs centered around empowering clinical teams to drive improvement through children and young people's engagement. So that is fantastic work. So Megan, if you could spend maybe 4 or 5 minutes just telling us about that.
Happy to. Just checking that everyone can hear me okay. Yeah, I see lots of nods. I've got my colleague Emma here with me as well. So Emma Sparrow, she's head of engagement for our RCPCH and US team. And me and Emma will kind of tag team it. I know we've been told only 1, but we'll try and keep it to 4 minutes. So quality improvement at the Royal College of Paediatrics and Child Health has kind of taken a 7-year journey, really. So we started off with a safety huddle program that went out to 50 teams in England and Wales, and then established a diabetes quality improvement collaborative, and that model was based on something from Sweden, where they trained up whole MDT, so whole multidisciplinary teams in quality improvement over a 9-month program. Very early on, we had asked for children and young people's voice to be part of it, and we invited a young person and their parents to attend the first training event. What we realized very quickly was that the clinical teams that were part of the training took that as the story. They took that as the voice. And a lot of the quality improvement work that they went back to their local regions to do was based off of that. We brought in Emma, who is our ANDUS team, and ANDUS at RCPCH starts with rights, and it talks about engagement and children and young people's voice and the tools to do that. So then we switched very quickly with our quality improvement programs to centering our quality improvement methodology and our training around co-production and the power of children and young people's engagement. So we are looking to skill up our clinical teams in tools and resources and frameworks to go out there and do co-production, co-design, and go and listen and hear their children and young people's voice from their families themselves. So rather than us presenting the voice, it's skilling up and empowering them to do it themselves with their families, and hopefully make them feel closer to the improvement work with their families together. So as part of that, we realized that we were only working within the programs that we were running, and with only the clinical teams that were participating in the program. So we set up and we established an online sharing hub for quality improvement called QI Central, and we'll share the links with you in the chat. QI Central is a kind of open access, free to access website where we encourage sharing of pediatric projects, quality improvement initiatives, news, the latest updates and resources from across the child health community. Alongside that, we produced open access modules, and one of our most popular one is our Children and Young People's Engagement module. The modules themselves are not kind of targeted specifically at a specific profession. So it's for anybody, and for us, improvement, there is no hierarchy. Anyone and everyone is involved in improvement, and no improvement is too small. So with that, our open access modules is going to reflect that. They're easy to access, bite-sized, short videos and instructional kind of resources and frameworks for people to download, for them to just dip their toe in and try quality improvement within the child health arena. And the module, the Children and Young People's module, is central to that. So I'm going to hand over to Emma, and she'll tell you a little bit more about our Children and Young People's engagement approach.
Thank you. So our approach is all about making sure that we really engage with children and young people where they're at, and give them really developmental opportunities, seeing their journey as part of our journey as well, and supporting them to make sure that actually, like Megan said, that their needs are met, but their children's rights are met as well under the United Nations Convention of the Rights of the Child. So bringing something together like QI Central and the module was just a dream. Children, young people, parent carers and paediatricians have been working together for a couple of years on how to make sure that they can share that engagement passion, but create an engagement movement where actually paediatricians, allied health professionals, nurses feel really confident to engage, and to do that in a way which is really meaningful. So they wanted to create resources that meant that actually we could really provide information, advice and guidance from the national base, but really like skilled up that local context, and gave them permission and confidence and that feeling of competence really to be able to work with local partners like schools and local authorities and hospital, schools, youth workers, charities, to really think about that that bigger view in terms of engagement. So they got totally involved. They thought about what engagement means to them. They thought about, through talking to the paediatricians involved, what might help in terms of QI resources, and kind of like between us all, we created this module, which is, it's just amazing. And so when we told them, we saw them on Saturday, that this was happening, they're just so overwhelmed at the fact that, one, that there's been like 2,000 unique views since it launched just before Christmas, but also that it's really making a difference and inspiring others, because for them, that's their engagement journey. They just want to inspire, and they want to work collaboratively, and they really want to, make a difference together. So that's kind of our approach, and you can see lots more, and I've dropped the link into the chat as well.
Yeah.
But, yeah, thanks very much.
Okay, lovely. Thank you, Megan and Emma, and thank you for being mindful of time. I'd like to just take a minute to welcome my co-facilitator, Carol Munn, to the room. I was explaining, Carol, this is new technology for us all, and we're all kind of learning as we're going along. So delighted you're able to join us. Would you, Carol, just like to introduce yourself? Maybe if you take yourself off mute at the bottom and introduce yourself, that would be lovely. Thank you.
I'm glad you reminded me about the mute button. I mean, it's quite unusual for me not to be talking and being listened to, so people laugh when I don't turn it off. I'm a lived experience partner, and was one of the judges that shortlisted these 4 amazing entries, and I'm passionate about co-production, so it's good to hear that co-production's been involved in this. And actually, why wouldn't you? Is my sort of take on it. So that's
yeah, absolutely. And Carol, while we're on this one and is co-production, is there a question you'd like to ask Emma and Megan to pull out?
I just wonder how easy you found it to involve the parents of the children to get them on board.
Yeah, so our model, so my background's youth and community, that's my qualification. So we bring that expertise in, and I think that's what's been really valuable with this project, that it's really united that youth and community work experience, the paediatric experience, the quality improvement specialism. So for us, it's kind of our everyday to involve children and young people and their parent carers. So for the age range for this project, it definitely was like down to as low as 11. And I would never ask a parent carer how old they are, far too nice to do that. But I think for us, it's about always making sure, like when we were having the sessions to work out the content, that it's done in a way which is inclusive. So, you know, we have had children and young people involved with different access needs, and to make sure that it's fun, because they're here to volunteer. They're not here to have the most boring experience ever. And that it's something actually that they can take on and learn from, as well as us supporting others to learn. So if you get that mix right and you set it up in the right way with participatory activities, then actually they all worked together really well, and they all brought their own specialisms, whether that was and experiences, whether that was the children, the young people, the parent carers, or the paediatricians involved.
Yeah, excellent. Thank you. Thank you so much, Megan and Emma. And I'd love to be able to hear more. But I think we'd like to move on next to the Stay and Thrive. So that's Ed Cox. If you would like to spend about 5 minutes now on telling us about Stay and Thrive and the work there around retention of internationally recruited nurses.
Thanks, Diane. Good morning, everyone. My name's Ed, and I'm the international recruitment lead for the Southwest region. I'm joined today by my colleagues Fiona, Katie, and Angie, who are also part of the programme. It's really great to be here. Just to tell you a little bit about our programme and the improvement journey we've been on, and with this obviously particular reference to spread. So we know in the NHS there is a very large, successful international recruitment programme that is underway and is accelerating rapidly to help support the workforce growth that we need across the NHS. And ethical recruitment is obviously absolutely central to that programme, and making sure that the nurses, midwives, and other healthcare professionals we recruit from international sources have a great experience and stay and thrive, hence the name of the programme that we're leading. The aim of the Stay and Thrive programme is to really positively impact on the retention of those international colleagues when they join the NHS. And as part of this programme, there is quite a significant scale to it. We are working across 2 regions, so both the Southwest region and the North Eastern Yorkshire region. We're working collaboratively, and my equivalent in the North Eastern Yorkshire can't be here today, but Victoria Bagshaw has been absolutely instrumental in the programme. We've drawn together 41 NHS organisations across 11 systems within those 2 regions over the last 9 months. The 2 regions are obviously geographically distinct and are quite different in terms of their setup. But that for us was a really important point in terms of generating the diversity and understanding the challenges. We've also partnered very closely with the University of Huddersfield, because for us, a really important part of this project, both in terms of the learning as we went and also the spread, the resultant spread of our learning, is really important that it had the right integrity and the right rigour for that wider spread. I would add that the programme that we've developed, and I'll talk a bit about that, is really people focused, and it is completely optional. We haven't mandated involvement in this improvement programme, but what we've seen is 200 colleagues join our community of action, and we refer to them as the activist community, and those range from those working in the HR and recruitment teams to clinical leads, internationally educated colleagues themselves, and a range of experts as well, who've come together as part of that community of action, because we recognise that their influence in terms of spread within their own organisations and their own systems and their regions is really, really key. We thought really carefully about how we approach this, thinking about what's gone before in terms of production of best practice guides, checklists, etc., which are great. but we thought we needed to approach this in a different way, given the challenges we know that our international colleagues face with integrating into the UK. So we thought about what had and hadn't worked before and wanted to take this to the next level. And so the Stay and Thrive programme builds momentum for change. And we've done that through trying to create an understanding about what are the challenges that internationally recruited colleagues face, and how can we understand why some organisations deliver really, really, really great outcomes with access to the very same resources as their neighbours. And so we've looked at this through the lens of positive deviance, and applied that throughout the programme. And in terms of what we're doing, we are on a journey. We're 9 months in, but we know we've got further to go. But we've already been able to help reshape some of the national guidance. We've inspired people to create new roles within their organisations. We've had people who've actually got Stay and Thrive within their role title in the 2 regions. But I think the spread has also happened both within those 2 regions, but we're seeing Stay and Thrive pop up elsewhere in the country, and it's spread through reputation and through that reach. So just in terms of just some facts really about the scale, the NHS recruits 16,000 internationally educated nurses a year. So huge number of colleagues bringing their vast experience into the NHS. But I think what was really staggering is we partnered with We Nurses and undertook a month-long Twitter takeover in April and ran a series of evening tweet chats. And when we looked at the reach that we'd had and the spread that we can effect from that, we'd reached over 7 million people used just that month-long campaign. So I just want to finish off, Diane, if I can, just by saying that we're obviously delighted to have been shortlisted. It'd be great. Any colleagues that want to form part of this activist community, you're very, very welcome to do so. And looking at the numbers of nurses on the NMC register, 68,500 nurses and midwives on the NMC register from outside the European Economic Area. So again, if you want to come and join the campaign, so we can hopefully help to ensure our internationally educated colleagues have a great experience.
Excellent, thank you, Ed. I think it's great to see. Maybe if I just make an observation rather than a question, I think it's great to see a model of spread that comes from the work itself rather than the more traditional top-down kind of guided, mandated, perhaps mechanistic approach to spread. This is going with the energy and spreading through reputation, spreading through peers, through networks. It really has to be a way of spread that we need to be able to utilise more extensively and more efficiently. So I think there's lots of learning there. Very welcome to hear, very welcome news that you're partnering with a university, and be looking forward to seeing the learning that comes out. And that was what I wanted to ask you, but I think we just need to move on. I want to make sure that we have time for everyone. So Georgina, if we could ask you to now take the stage as such, welcome. And if you could speak on behalf of the shortlisted item from Futures NHS teams and Futures NHS communities, and you've been shortlisted for enabling rapid acceleration of virtual collaboration for improvement across organisations and systems. So if you could speak for up to maybe 6 minutes now, on the work that you've done, that would be fantastic.
Brilliant, thanks so much. And it's really lovely to be here with some other really fantastic shortlisted colleagues as well. So my name's Georgie Farmer, and I'm the Senior Account Manager for the Future NHS platform. I lead on the customer support offer, covering training, support desk and account management for our 200,000 users on the platform. And as Diane said, so our improvement we're talking about today is how the collective of communities on the Future NHS platform use the platform to harness the power of virtual collaboration, to change and innovate and spread those innovations to respond to the pandemic and the recovery over the last 2 years. So I'll just start with what is Future NHS for those that might not be aware. So Future NHS is a collaboration platform from the NHS that is free to use. It's open to anyone working in the NHS wider sector as well. So government, local government, voluntary, academic, suppliers and partners, anyone really working with the NHS on delivering or collaborating are welcome to use the platform. And just to say as well, it's not something that's kind of top-down mandated. It's something that's really spread through bottom-up. You know, people are choosing to use this because it's helpful. It's not something that they're told they have to use. So I just want to start by saying, you know, the platform was in existence before the COVID pandemic, but we really saw the communities and the number of people needing to use the platform for virtual collaboration flourish at the beginning of the COVID outbreak. We saw more than 150 communities were created or repurposed to support the pandemic, ranging from, you know, national teams, all of the regional teams, local systems, partnerships and networks, uptaking the platform to kind of rapidly change and deliver those real changes that we needed to see in the health system. And so we, the platform team, responded to that scale, rapid uptake and kind of scale of use by through a number of ways. So enabling self-registration for NHS staff and government, rapid workspace approval, faster turnaround for support. We put on masterclasses for communities of practice and facilitating knowledge sharing, and establishing and fostering peer support networks to build capability. We also published a COVID-19 workspace directory to help people find key resources and networks, and reached out to new COVID-19 communities to support them to develop and grow. We also played a role in matching and connecting similar communities, so reducing duplication and fostering links across the system, and worked with stakeholders to develop things like hub spaces, you know, to provide a single gateway for users to find relevant communities that were there to support them. And we helped national and regional response cells connect to pre-existing communities on Future NHS as well. So there's thousands of communities to talk about on the platform. There really are, and there's not time today to mention all of them. So I just wanted to lift up one fantastic example to really paint a picture for you, which is the homelessness and inclusion health community that we have on Future NHS. So during the COVID-19 pandemic, a decision was made to get homeless people off the street, and an integrated approach was needed, involving a range of public and voluntary sector organisations working together. The NHS England and Improvement team worked closely with colleagues in Public Health England and brought together a group of professionals to tackle this issue and enable the sharing of updates and good practice. In the first instance, it was done through online meetings, but the team have said that it quickly became apparent that an online system was needed to enable people to share resources, knowledge, and discuss issues. So Future NHS enabled them to share their thoughts online and engage with others grappling with similar problems. And stakeholders have been able to learn from emerging good practice and prevent duplication. For example, they're sharing things like practical resources such as risk assessments, clinical resources, and reporting tools. And going forwards, moving on from the pandemic into recovery, the workspace has continued to be a really useful resource for the sharing and learning and spreading of good practice, supporting that growing agenda on tackling health inequalities. And the public and patients benefit from this kind of uptake of virtual collaboration because workspaces like Homelessness and Inclusion Health have saved vital time, reduced duplication of effort, allowed resources and good practice to be shared rapidly, and learning, insights and ideas are captured in one place so that the whole NHS system can access them when they need to. Local system leaders were better supported through early information and access to resources, access to peer support, and routes to engage with national leaders. And on the other end of that, national and regional leaders were able to engage with local systems in an improved way because virtual collaboration allowed for that rapid reciprocal communications and feedback from on the ground. And virtual collaboration has supported a culture of co-production, collaboration and learning, and also that frontline empowerment. Anyone can use Future NHS at any level of the system. Yeah, I'll pause there.
Yeah, as with all of the entrants, it's an impossible task that we've asked of you to try and summarise all your work in a short period of time. But if you do have any links, anything else, then please do. The question here from Devon Elliott, did I hear 200,000 members?
Yes, just over. So about 220,000. Yeah.
I think that must be a record somewhere, Devon. Yes, absolutely. So I think we, in light of the time, Carol, should we just move on to closing, or did you want to sneak a quick question in there?
Well, just a quick question for Ed Cox, and that is that when nurses come from abroad, and how much of a problem is it that they understand our colloquialisms? I'll tell you why I'm asking, because there's a story that goes around, and apparently it was verified, that we got an elderly man who asked the nurse, said, could she help him because he wanted to spend a penny? And so she thought he wanted to buy a newspaper and took him down to the shop. Now, after having read this, we sat down, friend and I sat down, colleague and I sat down, and we came up with 28 colloquialisms that made absolutely no sense whatsoever unless you use them in your everyday language.
Yeah.
So does that turn out to be a problem?
I think it's definitely a challenge, Carol, and it's something that we've definitely picked up through the Community of Action, and we've seen lots of organisations that are involved developing their own translation guide, if you like.
Yeah.
They're very area and geography specific, but it's certainly something that I think has been a positive to come out of the programme as well. So yeah.
Yeah, thank you for that, then. In the remaining few seconds, Paul has posted, there is a live poll, and I was going to just quickly hand back to you, Paul. But just before that, just to remind everyone that the winner, and good luck to everyone, will be announced this afternoon at 4:15, so Tiara time. Come join the awards ceremony this afternoon, 4:15, for the announcement. And back to Paul, if you can take us through any final housekeeping and how to move on in the next a few seconds. Thank you, Paul, and thank you everyone for joining, and particularly for the presenters. Really appreciate your contributions. Paul.
Good luck to all of you.
Yeah, absolutely.
Thank you very much, and yeah, echoing those sentiments, good luck to everybody for this afternoon. Before people move on, if you look in the chat column at the top, there's just an option for polls. It's just a very simple click. If you could provide feedback before leaving, that'd be appreciated, because it just helps us inform these decisions for the future, so we can try and make these the best experience for everyone. When you've done that, if you look on the left hand side of your screen, you'll see the icons. If you click on the reception tab, that will take you back to the main room, and then you'll see what else is available at this time. Alternatively, you can click on sessions, and that'll take you straight to the sessions tab, and then you can pick another one of the awards to go and hear what's going on with that category. Thank you very much.
Okay, thank you everyone, and yeah, enjoy the rest of the day and tomorrow as well, and hopefully see you at the awards ceremony this afternoon, 4:15.
Enjoy the rest of the day.
For those of you who are who were good enough to speak, I hope you were happy to do the same again in a few minutes. It's a bit of a rapid turnaround. I don't know if you want to have a stretch or grab a drink, or if you're feeling all right. Carol, are you happy if we run it through more or less the same? Obviously, we'll be able to have you introduce yourself at the beginning.
Yeah, I'm quite happy, but I'd like a little bit more airtime, if that's okay with you.
Yes, yeah. And how would you like that?
More, questions for the nominees.
Okay. So I guess it's down to the nominees. We've got that set amount of time. So if there is time at the end, and that was the challenge, that the time was taken by the speakers. I guess that can be a request we make of the speakers, because we do need to finish on time to allow people to progress on to the next sessions.
Well, we could always give them a countdown, say that, we're saying 3 or 4 minutes.
Well, we have now 3 presentations, so if we say about 6 minutes each in total. Now, if that's 6 minutes presentations, is no questions. if it's, so that's how we need to divide it up. But it's about 6 minutes, which is really tight per shortlisted entrant. So that's why we didn't have the questions the last time, Carol, because otherwise we would have gone way over.
Well, I think it's important that we get the questions in, because my take is that if they can't get their story over in 3 minutes, then they're pumping it up a bit. So I think there's such a lot to cover. So maybe when Georgina, Emma and Megan come back, we'll have a quick chat as to how we can best do it, because it is a balance, isn't it? Ideally, we'd have sufficient time that the presenters can cover what they feel they need to, and that we can ask questions and get some interaction. So welcome back, Emma, Ed, Megan and Georgina. Carol's with us, so you'll be able to hear from Carol as well. We were just chatting about how to do the second one, which starts just about now. We have each of you as an entrant have 6 minutes, right? And that 6 minutes, if you take the 6 minutes, we can't ask the questions. And Carol was just saying that she feels, and I agree, it's important to have some kind of interaction. So if you could maybe, what you did was fantastic, and it's a really big ask, but you've got 6 minutes. It would be really good to not take 6 minutes, so that we can ask at least a question. And if what you say, you can focus as you've done, but particularly as you narrow it down a little bit on spread, that would be fantastic. So I think we're at 10 past. So Paul, are we due to start again at 10 past?
Regular sort of build this team with a tiny bit.
Yes, we were due to be restarting at 10 o'clock. Bear with me.
Sorry, Paul, I couldn't hear you. Are we still?
No, I just temporarily muted Carol because they were talking about tea. Sorry, Carol, you're just muted at the moment. We could hear the tea.
Yes, I'll have a cup.
We are due to restart any time now. I think the numbers are just ticking up at the moment. We've got 63 people with us again now.
Okay.
So I think we'll be ready to start basically when everyone is ready.
Okay, right. Well, let's get started then. For those of you who've joined us, a very big welcome to all of you joining us. This is the second run through of the NHS Improvement Awards Showcase, focused on spreading change and improvement across systems. And we're delighted that you're able to join us, and delighted that we have some speakers here from the shortlisted entrants, and they'll be telling you shortly more details about the work that they've been doing with a particular focus on spread. So I'll introduce myself and ask my co-facilitator Carol to introduce herself. As you're joining, please use the chat box. Please say who you are, where you're joining from. Let's use the chat box as a way of connecting and communicating. So I'm Diane Ketley. I'm a member of the NHS Horizons team. Absolutely delighted to be here and to welcome everyone here today. My background is as a clinical pharmacist, and then moving into research and the area of improvement at local and then national level. And my co-facilitator for this session is Carol Munt. Carol, would you like to introduce yourself, please?
Hello, I'm Carol Munt. I'm lived experience partner, and I'm passionate about co-production. So it's good to, and I was one of the judges for shortlisting these nominees. And so I suppose I ought to have a gold envelope now and just say, and the nominees are, but I think as you've all got your names underneath it, we can skip past that bit. But just congratulations, all of you, and let's have a little bit of a story about what you did and how you got there.
Excellent. Thank you, Carol. And Paul is our moderator for this session, and very pleased that Paul's here with us to help us with any technical issues. Paul, would you like to introduce yourself and give us any housekeeping information we all need to know?
Thanks very much, Dan. And again, congratulations to everybody. Thank you all for joining us this morning. This is an open session. We'll be hearing from the award nominees, so please do give them your attention. If you have any questions or comments, please post them in the chat, and time permitting, we'll come to as many of those comments and questions as we can. Thank you.
Okay, yes, as we go along, time is tight, and we saw that in the first run through this. We just a little more time. So we may not be able to answer your questions directly, or certainly not all of them, but please, the presenters, keep an eye on the chat box and please answer the questions yourselves as we go along if you can. So the format for this session is very shortly, we'll be asking 3 of the 4 shortlisted nominated entrants to tell us a little bit about what they've done, and then we'll take the opportunity to ask a question or 2 of them. I'd just like to say how delighted I am that spread is a topic in the big conversation. I said this in the first session, but I've been interested in spread and adoption, scale, sustainability for a long time, and feel that it has not been given the kind of focus and energy and attention that it needs as an integral part of change and improvement and innovation. So I was so excited when I saw that it was one of the 6 topics, and that here we have an award for spreading change and improvement across systems. So it's fabulous it exists, and it's great that we have you here today, and that we can hear more about what you've done. Congratulations again to the 4 shortlisted nominees. You will have heard, hopefully, earlier than be announced. If not, we're going to hear from 3 of the 4. I'll just mention the 4th first, so that they're not forgotten. Unfortunately, because of timing issues and notification, the people able to speak to this nominated award, nominated entry, are not able to join us today. There are members of the team present, but I think we totally understand that short notice has proved difficult. But they are NHS South, Central and West CSU, and they were shortlisted for creating a national immunisation service. So they're the 4th nominee who unfortunately we won't be able to hear from. So let's move on to the first one. So Carol, over to you, and to the first one, which is the Royal College of Paediatrics and Child Health and us. And we have a restriction of 6 minutes in total, Carol, for you to facilitate Emma and Megan, who are going to share with us the work that they did around a quality improvement training programme and driving improvement through children and young people's engagement.
Well, I guess you've pretty much done the facilitating and the introduction for me. So over to you, Emma. Let's hear which one wants to go first, Megan or Emma?
I will do a bit of a preamble and keep it short and sweet, hopefully. So QI at the Royal College of Paediatrics and Child Health is a 7-year journey, and we do national QI programs for diabetes and epilepsy. Very early on, we realized that more than just presenting the children and young people's voice as part of quality improvement. Sorry, there was a bit of echo. Can you hear me okay?
Yeah, fine, fine, Megan.
I'll carry on. But rather than presenting the children and young people's voice, it was more important and integral to quality improvement that we upskill and empower our clinical teams to learn and know how to engage children and young people's voice within their work themselves, and with their own families that they care for. Particularly, we wanted to focus not just on parents and carers' voice, but on the voice of children and young people themselves, and the ability to bring that into your quality improvement work. And that has been central now to our quality improvement approach. So we realized that we were only really teaching this and upskilling those that were involved in our programs. But there are over 18 specialties in pediatrics. So on our open access, free to access quality improvement online hub, QI Central, we produced with Emma and the Andus team, who are our engagement team at the college, an open access module, which is for everybody. So anyone who's in child health, across health, education, social care, and anyone of any profession. It's an easy to access, bite-sized module that introduces you to young people and children's engagement. And Emma will be able to provide more details of that herself.
Thanks, Megan. So the approach that we've got for RCPCH and us is that we get children and young people and families together to really share in the journey, but we really start from a rights-based approach. So noting the United Nations Convention of the Rights of the Child, where they have a right to be involved in decisions that affect them and the right to the best healthcare possible. We really make sure that actually their development and their journey is as important as and integral as the QI work we're doing or the training or whatever else it is. So for this, the RCPCH Engagement Committee, who include young people, parent carers and paediatricians, really wanted to think about how could they skill up workers in a different way, how could they make sure that they had permission and the skills and the confidence to work locally with children and young people to make a difference, but by having that kind of like national input. So they came together, we had lots of kind of like creative sessions, some of them were online because of COVID, some of them were hybrid, where, you know, they really worked through those like tricky problems as to, you know, what is the thing that we need them to know and how can we make sure that they do it in a way which really works for children and young people, but also builds on patient experience and takes it to the next level of social action and that quality improvement. So, I mean, they were totally chuffed when we spoke to them on Saturday and let them know that this was happening. And throughout, since their module launched, which was in December, and the fact that they've had 2,000 kind of like unique views has been huge for them, because they really see that actually it's the opportunity for those individuals and teams and people that are interested, whether that's local authorities or schools or clinical teams or allied health professionals, can, you know, get their ideas and support around how to make sure the spread of United Nations Convention of the Rights of the Child happens, but also how to make sure that we're really scaling up our approach to proper patient engagement and involvement that does include children and young people at the heart of that. So yeah, so it's been huge and they're so excited that we're here today representing them. But I'm just going to leave a couple of minutes in case anyone's got any questions. And I know one's just come in, but Carol, I'll leave you to facilitate the questions to us.
Right. Well, David wondered how much this facility cost, and I suppose my rider to that would be, was it value for money? Because inevitably that's the question that's asked. But then, how do you quantify improved treatment for young people, children and young people who've got diabetes or epilepsy? I mean. But my question will be, on top of that, is why did you pick diabetes and epilepsy? What was the particular reason for those two?
So just to kind of answer David's kind of question, QI Central is part of our website portfolio. So for us at the college, it's more staff and time and effort into producing something. But actually, a web page, and that's the beauty of an online platform, is that it's forever. So rather than just a kind of a morning session or a training program exclusive to those that are participating, something that's open access online, that's bite-sized, that's an introduction or a taster, is forever, and it's open, and it's for anyone to kind of look into. So that's what we really wanted with these modules and this approach, is to have as much access as possible and as much exposure, and to just introduce people to the idea that it is possible. I think a lot of people think that children and young people's voice, you know, it's not possible. We ask parents and carers, and that's sometimes the immediate response to quality improvement work with children and young people. But actually, it is possible. Children and young people as young as 3 or 2, you can engage them in your quality improvement work, and you can build your work and your efforts around that. So, I mean, it doesn't cost anything in terms of the actual website, the module. It was just a labor of love from us as the team at the RCPCH, but we believe in it, and we passionately believe that this is the right approach for quality improvement, and particularly quality improvement for children and young people. And in terms of diabetes and epilepsy, so the quality improvement programs at the college were inspired by something that happened in Sweden. So they had a diabetes quality improvement program, and they ran it with multidisciplinary teams. So rather than separate professions training, all the team trained together, and we were inspired by that. So we wanted to kind of replicate that really and pilot that, which is why diabetes was our kind of first program, because the Swedish model was delivered to a pediatric diabetes community. And then epilepsy, really, we have 3 key audits, national audits at the RCPCH, so the neonatal epilepsy and diabetes audits. And so it was kind of a natural progression that we aim to spread that success with the Diabetes Collaborative to epilepsy. But if you ask me, I wish I could do it and we could run programs for all 18+ specialties within pediatrics.
Well, thanks for that. And one thing that you said there that I hope everybody heard and will take on board, and that is the fact that you saw what they were doing in Sweden and you replicated it, because there's nothing worse than actually not bothering to look and see what other people are doing and having to start from scratch. Because, you know, bicycles only need 2 wheels, if you get my drift. So we really don't need to keep on inventing new ones. So yeah, I think that's very impressive. If anybody's got any more questions, please put them in the chat. And as you can see, Emma's been typing away there, answering some of the questions while Megan was talking. So congratulations, you two, and fingers crossed for this afternoon. Back to you, Diane.
Okay, thank you, Carol. So we'll move on to Ed now. Ed's going to join us and talk about Stay and Thrive on behalf of North East and Yorkshire and South West regions. And Stay and Thrive is about the retention of internationally recruited nurses. So over to you, Ed.
Thanks, Diane. So good morning, everyone. It's great to be here. My name's Ed Cox. I'm the Regional International Recruitment Lead for the South West, and I'm joined today with some colleagues that are in the audience, Angie, Katie and Fiona, and my colleague Victoria, who can't be here this morning, is integral to the programme. So thank you all for attending. So I just want to share some more detail about the Stay and Thrive programme that we've been working on, but just by way of context, we know that the NHS has a very large, successful international recruitment programme, particularly for nursing, supporting the workforce growth that we need across the NHS in England. And integral to that is ensuring that international recruitment is ethical, and that the colleagues joining us from overseas have a positive and fulfilling experience in the NHS. But we know that there is more to do to support those colleagues integrating into life in the UK and working for the NHS. So the Stay and Thrive programme was born 9 months ago, and the aim is to positively impact on the experiences and therefore the retention of those international colleagues in the NHS. And we've brought together 2 regions, as you said, Diane, the North East and Yorkshire region and the South West. So we've got a huge geography, and although they are geographically distinct regions, each has its own challenges and its own nuances. Within the programme, we're really proud that we've managed to engage 41 NHS organisations. So in terms of scale and spread, we have got a big reach already, and that spans 11 integrated care systems in the time that we've been running the programme. But I'm also really excited that we've partnered with the University of Huddersfield, because what was really important to the project team is making sure that any spread and any materials that we produce as part of this programme has the necessary underpinning academic rigour and credibility. So that has been a really key partnership. The programme itself is completely people focused and it's completely optional. So those people that have joined the programme have done so voluntarily, which I think is really key. And in terms of colleagues that have joined us, we've created a community of action. We refer to it as the activist community, and there are over 200 people that are a part of that community. They've chosen to be part of the community of action to spread change, both within their organisations, within their systems, and obviously within their region. But I think one of the key things I would say about those colleagues is the passion that they all have for improving the experiences that international colleagues have when they join the NHS and work in the NHS, and hence the Stay and Thrive name. We thought really carefully about our improvement approach, thinking about what's gone before and what's worked and what hasn't worked. And whilst we recognise that best practice guides, etc., checklists are really, really, really useful, we need to do something slightly different in this case to take our improvement journey to the next level. So Stay and Thrive really does build momentum of change by creating an understanding in the community of the challenges that our international colleagues face. on a range of levels, and then understand why some organisations deliver much better outcomes and much better results when they've got access to the exactly same resources. So we're looking at this through a positive deviance lens, and we've made sure that is absolutely runs right the way through the centre of the programme. So to date, what we've done is we've managed to help to reshape some of the national guidance, which I think has been really, really key. Inspired creation of new roles within organisations. We've heard of people who've actually got Stay and Thrive as part of their job title now, because they are absolutely embedded in supporting international recruits. And I think in terms of spread, we've seen spread outside of those two regions. We've seen this popping up elsewhere. And I think that is really important. I think that's by reputation rather than by any sort of forcing of that into other areas of the country. So I think, again, picking up on the co-production element, Carol, I think there's definitely been lots of that going on. We're all, at the end of the day, we're all patients of the NHS as well as staff that work within the NHS, and we've absolutely made sure that we've used lived experiences and heard the voices of international recruits as part of this work. And then just a couple of facts, really. So the large international recruitment programme the NHS is working on, there's over 16,000 internationally educated nurses that joined last year alone. So there is a massive amount of work to be done. But again, in terms of spread, and I know that's the focus of this conversation, we partnered with We Nurses and undertook a Twitter takeover for the month of April, and did a series of evening Twitter chats. And when we looked at the analysis of that, we managed to reach out to over 7 million people through that Twitter platform, which is great. So just to finish off, we're absolutely delighted to have been shortlisted. You can hopefully tell how passionate we are about the work. This is also an invitation for colleagues who may want to join with that work and hopefully improve the experience of international colleagues.
Well, I'm impressed, and I just wonder whether you could put your contact details up in the chat box so people can get in touch with you if they want to. But I think the fact that you've spread outside of the two areas that you started it with says something for the fact that it's a necessary thing. And I just wonder, what was the main problem that you came across that you found that international nurses have when they come to the UK?
I think
language, or is it culture, or what?
I think there's a whole raft of different issues, Carol, when you look at it, when you sort of break it down. When we looked, so this has been underpinned by, as I say, some research that the University of Huddersfield are undertaking and are continuing to undertake with us. But the integration into both society in this country and also adapting to potentially new practices within the NHS and the way that is structured, and also then managing moving such a significant distance from home with family it's really multifactorial. And I think that was one of the key things, was seeing the whole person, not just somebody who works in the NHS, and that's been a key piece of learning.
Excellent, thank you, Ed. And there are lots of questions I'd like to ask too, but we need to make sure that we're fair and that Georgina has time before the session finishes, and people need to move on to other things. So thank you for that, Ed. Very impressive work, really important work as well. So Georgina, last but no means least, these are not in any particular order. If you would be good enough to now tell us about future NHS team and future NHS communities.
Fabulous, thanks Diane. So hello everyone, my name is Georgie, or Georgina Farmer, and I'm the Senior Account Manager for the Future NHS platform. I lead on the customer support offer, covering training, support desk and account management for more than our 200,000 users on the platform. And as Diane introduced, we're talking about virtual collaboration today and how Future NHS has supported our collective of communities to harness the power of collaboration online, to change and innovate and then spread those innovations to respond to the pandemic and recovery. So before I get into that, I just thought I'd explain a bit about what Future NHS is, for those of you that don't know. So Future NHS is a virtual collaboration platform from the NHS. It's free to use, and it's open to anyone working in the NHS and wider sector. So that includes local government, voluntary, charity, academia, suppliers and partners as well, working with NHS organisations. So you don't need an nhs.net email to collaborate here, and that's the kind of power it has of bringing people from all different parts of the sector together. It's something that people aren't told they have to use. It's not top-down mandated. It's definitely grown bottom-up through kind of grassroots spread, and people use it because it's useful. So I'll focus on how they use it for the pandemic. So we had more than 150 communities created or repurposed to support the pandemic response on the Future NHS platform. They covered, a huge breadth of use cases, ranging from national programs and teams, all the regional teams, local systems and partnerships and networks. Really used by frontline staff as well as people in those supporting roles as well. In terms of spread, people were setting up communities on the platform, for example, to support the delivery of online consultations. One region was setting that up, others were seeing that they could also do that, copying that really easily and setting up communities to respond to those rapid needs at the beginning of the outbreak of COVID. The Future NHS team supported people through a range of different ways to use the platform, scaling up our support offer and linking communities together to ensure their learning was shared, there was reduction in duplication, and teams were kind of cross-linking so that users could find all of the communities and networks that were useful to them. There's not much time today to talk about the kind of, we've got thousands of communities on the platform, but I just wanted to lift up one really good example to demonstrate how this helped teams in the pandemic, and that's the homelessness and inclusion health community we have on Future NHS. So during the COVID-19 outbreak, a decision was made to get homeless people off the street. An integrated approach was needed, involving a range of public and voluntary sector organisations working together. The Homelessness NHS England and Improvement team worked closely with colleagues in Public Health England and brought together a group of professionals to tackle the issue and enable the sharing of updates and good practice. This started off as online meetings, but it was soon apparent that an online system was needed to enable people to share resources, knowledge and issues. Future NHS enabled them to do this and engage with others grappling similar problems across the country. And stakeholders have been able to learn from emerging good practice and prevent duplication. For example, they've shared really practical resources such as risk assessments, clinical resources and reporting tools. And going forwards, this workspace continues to be a really helpful resource for people to learn from each other and share good practice to support the growing health inequalities agenda. Patients and the public have benefited because the response of their local NHS was improved. So workspaces like homelessness and inclusion saved vital time, reduced duplication of effort, and allowed resources and good practice to be shared rapidly. Learning insights and ideas were all in one part of the NHS to be easily accessed by all NHS systems. And local system leaders were better supported through early information and access to resources, peer support and clear routes to engage with national leaders. National and regional leaders were able to engage with local systems in an improved way as well, allowing for that rapid ongoing reciprocal communications and feedback from people sort of on the ground. And virtual collaboration supported a culture of co-production, collaboration and learning and frontline empowerment. And I'll pause there because I know we're really short on time. There's much more I could say, but I will post a link to the platform in the chat as well so people can go on and join it today.
Excellent. I think we have a couple of minutes. So Carol, do you have a quick question?
I was just going to say it's very difficult when you're so passionate about something that you have to sort of try and condense it down into an eggshell, but you did a pretty good job there, so I think everybody got the message. And I'm impressed by the fact that you've all embraced co-production, that you've all embraced the learning, not the expertise that patients and their carers can offer you, because we've all got expertise of some sort. Might be a different type, patients might have a different type of expertise to yours, but it's expertise nonetheless. And just bear in mind that patients come forward and carers come forward for the simple reason that they do want to help. So I'm pleased to see that you guys have taken it up, and good luck. Keep your fingers crossed and you'll know later on this afternoon.
Yes, that's right. Thank you. So just as a reminder, the winner will be announced this afternoon at 4:15. So hopefully everyone can join the award ceremony. Time to join and to celebrate. I think to celebrate all those who have been shortlisted, because we've heard this morning about such excellent work. What a task to have to just pick one from all this really good work. But we will find out who the winner is this afternoon, 4:15. So yes, please do join that. If you have any information, presenters, please pop it in the chat box, because that will be captured and can be shared with others as well. And really just time now in the final minute to hand back to Paul. You've mentioned a poll. Paul, do you want to explain what you'd like us to do and help people move on to the next session? Thank you. And again, congratulations to everyone, and thank you everyone for your contribution, both in the chat box and presenting. It's really made these two sessions really excellent. Thank you. Paul.
Thanks,
thank you,
Diane, and thank you very much to all of the award nominees, and good luck for later today. You're all very worthy candidates, so good luck to all of you. Thank you as well to Dan and Carol for holding us to order and giving us the time to hear all those fabulous stories as well. Just before people leave, if you look in the chat panel at the top, there's just a brief poll, simple one question poll, just to get feedback on the session, to help us shape these sessions for the future, for anything we run going forwards, to make the best experience we can for all. Once you've had a chance to do that, if you look on the navigation panel, which should be on the left of your screen, there should be a button saying reception. And if you click on that, that will take you back to then the main area for the session, and you'll see what else is available at this point. And thank you all for taking the time to join us today.
Thank you. Bye-bye.
See you later.
Yes, enjoy the rest of the day. I hope you can join the other sessions, and tomorrow as well, of course. Thank you.
Just remember at the Oscars that one person will win in a category, but the others are always forever known as Oscar nominees. So it's pretty good to have got that far.
Yeah, well said, Carol.